Welcome to Family Health, a holistic healthcare show that aims to educate, inform, and uplift you on all matters health. My name is Liz and I'll be your host for today. Now, infertility affects 10 to 15% couples worldwide, with various contributing factors which we'll look at today. Cultural and socio-economic factors can also play a key role in people seeking fertility treatments. Today, we will speak to different doctors as they give us more of an insight into this vast topic.
Dr. Paul Koigi is my name. I'm an obstetrician gynecologist by profession, and I am also a fertility subspecialist.
My name is Professor Koigi, a professor of obstetrics and gynecology at the University of Nairobi, where I've been teaching since 1987.
So, how do doctors define infertility and how prevalent is it?
We usually define infertility medically as a situation whereby a couple has difficulty in getting pregnant if they have been trying for at least a year. On average, it's thought that 1 in every 6 people in the world suffers from infertility. That's roughly about 15 to 20%. And unfortunately, you find that less than half of those people who actually have the problem seek care. So in Kenya, we think that the number is around maybe between 12 and 15%, but in some areas in Kenya, it can actually go as high as 25 to 30%.
My name is Susan Joke. I'm an administrator by profession. I work in a consultancy firm based in Nairobi. And I'm a born-again Christian. I take pride in being born again. Christ is my savior. I got to know Christ when I was really young, and it has been a journey with Christ. I don't regret being with him, and I'm happy to be here.
Historically, there has been a tendency in some societies to place a heavier emphasis on women when it comes to fertility issues. Is that really the case?
Society has had the very bad habit of describing infertility as ile shida ya wamama. It's not actually a women's problem. Infertility is a couple problem. It takes 2 to be able to get a baby. So as far as the causes of infertility are concerned, in 1 out of every 3 cases, it's the woman alone. In another 1 out of 3 cases, it's the man alone. And in the remaining 1 out of 3 cases, both the man and the woman have a problem that is making them have difficulty getting pregnant. So it's roughly 50-50. So the men are affected just as much as women.
Most young girls have a dream. What was Susan's dream?
Just like any other young girl, I was looking forward to that time that I'll meet Mr. Handsome, then we get to go to church, then years later we get children and we become this lovely couple. Those were my dreams when I was growing up. In the year 2012, I did a beautiful wedding and I was happy to start life on the other side now. Life was good, I would say. And because I had really purposed and desired to have marriage, and finally here we are. I've been married and I'm happy about it. And yes, and I looked forward definitely to starting a family of my own where we have kids. Unfortunately, in God's plan, it never came to be. It never came to be for me to be Mama Somebody as I had desired.
Now, in the journey of fertility, age is one of the main determinants of fertility or subsequent infertility.
Age is a very important determinant of fertility. Fertility decreases with age, very, very, very important. So that age becomes the most important determinant of the capacity to reproduce. Now, when we say that, we can say that if you are below 35, it's much easier than if you're above 35. The reproductive efficiency as a whole, including carrying pregnancy, it is very good. Even the process of delivery is very good. In general, men are not as affected severely as the women. Remember, age is a composite of very many things, and functions also age. Like we said, you can't run fast at 50, but you can run very fast at 25.
Now, the stigma surrounding infertility often revolves around societal expectations.
For the women, the problem tends to be a lot worse socially because society has put the woman as being the recipient of blame majority of the time. So the burden of infertility is mostly borne by women. And the problem with that is that there is a lot of what we call stigmatization and ostracization. So stigmatization is where we say you are bad as a person. If you cannot get pregnant as a woman, you are bad. And then there is ostracization where you say if you cannot get pregnant as a woman, not only are you bad, but we who are not bad should now keep ourselves far away from you. And now that we call ostracization, where now they start being excluded from social functions. That's why they're not called for baby showers. When somebody has had a child, they don't call them. And it becomes a problem because it brands the person as somebody who is not worth being recognized as being a member of the society.
What are some of the things couples go through, and what was Susan's experience?
You feel like even the people who are planning things like the women group, like the people are planning for baby showers, but you don't get pregnant, so they don't want to involve you there because they are feeling like, now how will you take it if we invite? Like, it's already in the mind of people, it's like there's something you are lacking in you. You're not a complete being. So for me, I experienced this not to so much extent because of my family. My family were really close to me and they supported me, they prayed with me, but still I experienced from other quarters where you feel like there are places and opportunities that you cannot be given and you don't look like you're complete, even as a couple.
So how did Susan discover that she was infertile?
I had had people in the family, they had experienced infertility. When 3 months were done, I started thinking, what if this thing is also now happening to me, what I have seen happened to other people? So I was a bit scared and I decided to seek medical attention. And but then I was discouraged. I was told it's too early. You must at least let's try for longer. So 6 months down the line, I felt like, no, I'm not able to wait. I need to know exactly what is happening. Finally now, when one doctor felt, anyway, you've waited for some time, we need to do some tests and see what could be happening. So from the HSG, they were able to realize that one of my fallopian tube was completely blocked, the other one was partially blocked. And I was advised that, especially with the dye they had inserted as a test, it would be possible to unblock the one that was partially blocked.
We spoke about age as the main determinant of fertility. What other things contribute to infertility?
So if the tubes are blocked by adhesions, like I say in endometriosis and other diseases like pelvic inflammatory disease, then the transport system is affected. All right, so the sperm may not pass through in the fallopian tube to fertilize the egg, and when the egg is fertilized, we call that embryo, it travels back to the lining of the uterus and gets implanted. So that process can be affected if fallopian tubes are not ideal. And of course, that's what results sometimes in ectopic pregnancy. That's when the implantation occurs in the fallopian tube.
The problem with an ectopic pregnancy is that pregnancy is only supposed to be present inside of the uterus. Therefore, if a pregnancy is ectopic, the primary treatment of an ectopic pregnancy is to get that pregnancy out. Because when bleeding starts because the pregnancy has burst, or because the placenta has gotten stuck on an organ like, say, the small intestines or the liver, and the tissues start to separate, then it can cause bleeding that can threaten the life of the mother.
Then you can also have implantation failure, mainly because there are changes in the lining of the uterus. Now, we talked about hormones like in polycystic ovaries, but we can talk about adhesions and infections and fibroids and things like that. Today, women talk about PCOS, polycystic ovarian disease. I want to mention that as one of the most common in the young women. That's an ability to ovulate. So you're looking at the function of the ovary.
If we start off with the men, you find that the most common problem that interferes with his ability to be able to sire a child would be the ability to rise effectively to the occasion. And that can be influenced by diabetes, high blood pressure, intake of alcohol, cigarette smoking, use of all these other recreational drugs and substances of abuse.
Now, infertility can take its toll on couples in many ways and even cause some to go separate ways.
Infertility is a disease that tortures people. It's a very heartbreaking condition because when a man and a woman come together and they say that they are going to remain in an exclusive relationship and they want to get married, they remain together, the first thing they think about for a lot of couples is that how many children do we want to have? So when a year passes, a second year passes, a third year passes, a fourth year passes, and there are no children forthcoming, then it becomes a huge problem to the couples. It causes so much conflict and it affects both men and women psychologically immensely.
Infertility journey, it's a very painful thing to experience in life, especially in marriage and in African setup, where after marriage everybody is asking you of where is our grandchild, where is and all this, and people are starting now even to count for you. You got married in the year 2012, now we are in 20, so people are already expecting. So with all that expectation of the society, you feel a bit low, you experience stigma and all that, your self-esteem, you are not even productive in what you do. So even if you're working, you may realize you can even lose your job, you become like, now you cannot grow in your life.
Endometriosis is a common gynecological condition affecting an estimated 10% of women of reproductive age. What is it?
Endometriosis is a disease that emanates from misplaced growth of the lining of the uterus. The lining of the uterus grows and it is shed. Now, if that is implanted into the wrong place, it will grow and it will respond to hormones because hormones are distributed in the blood and it will menstruate. That is the problem with endometriosis.
As we have heard, fertility can have a profound emotional impact on the couples affected and can be a truly trying journey. But there is hope with the far-reaching medical advancements. Plus, we have heard of people who God miraculously gave children after many years of trying. After the break, we will look at one of the diagnostic procedures carried out that investigates the health of the uterus. If you're at home and have maybe gone through the journey of infertility, what are your thoughts or comments? Please let us know via SMS on 20316 or WhatsApp on 0786 316 316. See you after the short break. Welcome back to Family Health. If you're just joining us, today we are talking about infertility. How does it affect couples and what treatment options are available? Procreation is an innate human desire, with most people wanting to sire children at least once in their lifetime. Now we want to observe one of the many diagnostic procedures that doctors carry out to investigate the potential cause of infertility in a patient.
So diagnosis of infertility is actually a very interesting process. There's a whole host of questions that tells us about issues, whether it's going to be within the lining, whether within the wall, whether within the tubes, whether within the ovaries, and so on. Then we'll do a clinical examination. So the clinical examination will be in two phases. So we'll do a head-to-toe examination. Then now you'll do an abdominal examination. And then we'll do a pelvic examination where you now look to see the size of the uterus, whether you're able to find whether there is any swelling within the uterus, is there pain. After that, we do an ultrasound. We may do something called a hysterosalpingogram in order to evaluate whether the tubes are open or not. And we also may do a CT scan or a magnetic resonance imaging depending on whether there is a suspicion that there may be a problem with an abnormality of the structure.
Now, let us observe the doctor carrying out an ultrasound, which is a diagnostic procedure. Gel is applied to the abdomen and a transducer is moved over the skin. This emits sound waves, creating images of the uterus and surrounding structures. It assesses the size of the uterus, the shape, and the presence of any abnormalities, providing valuable information about reproductive health.
That is your ovary on one side. We go on the other side, and that is the ovary on the other side. And when we go down here, I'm going to make this a little bit bigger. This is your uterus. So when I move to one side there like this, you can see the ovary there. You can see the uterus down there. If I adjust the depth a little bit like that, you can see the uterus down there. And then we move to this other side and we get the other ovary.
Now, after Susan discovered she was infertile, what next?
So the only opportunity now I was left with, there are still many options that I was left with, because I could do IVF, I could do surrogacy, and also I could do adoption. Those are beautiful ways of getting children. But then, since my uterus were in perfect condition, I felt like surrogacy is a bit far-fetched. So I felt like the one that is more friendly to my case is IVF.
When a couple comes in, they have trouble getting pregnant. When the problem has advanced severely, then the ability to address the problem becomes compromised. For such patients, then the advice that we will tend to offer them is that rather than doing all these other treatments which are unlikely to work for them, we offer them advanced reproductive therapy in the form of what we call IVF, which stands for in vitro fertilization, whereby we stimulate the woman to produce eggs and we get sperms from the man, take the two, join them in the laboratory, have them grow to the best potential that they can grow, and take the best ones and transfer that into the woman, into the lining of the uterus, give her the necessary medications that are available, and pray God that it accepts to hold. And then if that takes, then we call that an assisted reproductive technology conceived pregnancy.
There's the issue of the gender of children, and we know that sometimes there's this traditional thing where a man wants maybe boys and the wife is only getting girls, and maybe the man is mistreating the wife because she's only giving birth to girls. Can you tell us about that?
The subject of gender is actually a very sensitive issue. In situations where there has been a repeat performance of getting a certain sex, whether it is a boy repeatedly or a girl repeatedly, and the desire is to have the other one, it actually can directly cause problems. However, strangely enough, the one who is likely fighting, the way you're talking about the husband bringing issues because the wife is only giving birth to boys or only giving birth to girls, coincidentally, it is actually the man who determines the sex of the baby. Because if you look at the way the eggs of a woman are, then the woman will usually have an X chromosome. But the X chromosome from the woman will join with another X chromosome from the man and give you a female. If you get an X chromosome from the woman and a Y chromosome from the male, that gives you a boy. So it's not the woman who determines whether you have boys or girls, it's actually the man.
Now, let us go back to Susan and see how her IVF treatment went.
The doctors was telling me that everything favors me for IVF. Age was favoring me. My ovaries, like everything was okay. So I really stood a chance and a higher chance to conceive through the IVF. That was an exciting time for me because now I knew with this one, it's a sure bet. And I went for it. Unfortunately, the first time we did it, it didn't work. That was a very, very low moment for us because we had really invested a lot. But there was still some hope because we had some frozen eggs still in the laboratory. So we went for it a second time. This time again, the doctors are really giving us so much hope about it and trying to establish what could have happened for the first time. Now, the second time we tried to be more careful so that because we are looking all the ways what could have happened. Unfortunately, again, after doing all that, the wait for the 14 days, that is 2 weeks, came to an end when my periods came and I tested negative. Now, I think that was the worst day for me. That was the worst, I think, for both of us, me and my partner, because I think the first time he was a bit strong to even comfort me and tell me we can still do this and all that. But I remember that time when the doctor told us no one was strong for the other.
Now, after trying to walk the journey of fertility treatment, unfortunately, my marriage failed. In the middle of this, everything that is happening, things happened too fast, and I even got separated from my marriage. So my family again embraced me and they brought me so close to them. I talked to mom and I told her, by the way, the issue with children, even if I ever get married, I'm done. Whether I'll have or not, but I'll never seek for any treatment. And my mom was, yes, my daughter, I will never want to hear you going through a knife in search of a child.
Women's bodies can sometimes reject a pregnancy. Let us listen to one such case.
So, a couple of years ago, I had a not so young couple that had had the unfortunate incident or an experience of having lost a total of 8 pregnancies. So every time the mother would get pregnant, she would lose the baby. So in her case, she was unfortunate enough to have had her body develop immune reactions against the baby. So every time she would conceive, her body would recognize the baby as foreign, and instead of her body toning down the immune system to accommodate the pregnancy, the body recognizes the baby as a foreigner and therefore recognizes the baby as an enemy and attacks the baby and then kills the baby. On the 9th pregnancy, she came. And she came in at a point where she was just about 10 or so weeks and was bleeding. So now she was risking losing the pregnancy again. So we were fortunate enough that we managed to get her at a point where we could investigate. So we did all the relevant tests and we instituted a very stringent set of management principles, and thankfully she was able to go home with a baby.
So what is Dr. Koigi's advice to individuals trying to conceive?
There are actually days that they could aim for, but because not everybody is good at being able to predict, we usually offer the option of coming to your doctor and get evaluated to determine how regular your periods are, and then while your periods are getting regular, we actually have something called ovulation prediction kits, and your doctor can actually offer you advice on how to use the ovulation predictor kits effectively. And when the ovulation predictor kit tells you that ovulation is around the corner, then you know that that is the time to make sure you make as heavy an investment as you can.
So now, after the heart-wrenching experience that Susan went through, was there a light at the end of the tunnel?
So, after saying that I don't want to consider marriage and I'm not even looking for children, I shared my story on the social media platforms and I didn't give my contacts. And the only person who was able to find my contact at my FB page is my my now husband. What I didn't know is that someone's prayer item was being answered. Because when I'm talking about my life experience and all that, someone was looking and saying that is my wife. So this man, he had a story, apart from the fact that he has lost his wife, he had a story that he's an adopted son and that the mother had never gotten her children of her own. And the mom is 80 years. And I was like, wow, these are the stories I like hearing. I want to know how this lady has walked from her young age. And you remember those days they were getting married early. So, and by then adopting a child, people used to say, mtoto wa kununuliwa. So it was not a very good thing. So for me, I felt like this is a story I want. Of course, I have my YouTube channel and I felt I want to reason to it, either for myself alone, but if she allows, I'll air it even for my followers. So for me, I wanted to meet that lady. And so I planned to meet the lady. How will I meet the lady without meeting the man? So definitely I met the man. We are still meeting till to date. And now I'm Mrs. Mushiri. Yes. I'm happy that I'm his wife and I'm the mother to his children, and I'm the grandmother to his grandchildren. So I am happy, I am contented, I thank God.
How should those interested in childbearing look after themselves?
To the young, your behavior today will affect your ability to get babies tomorrow. So if you are young now, if you're a teenager, getting sexually active during adolescence is a high risk factor for infertility in the future. For the older woman, it's important to remember that if you have interests in getting babies at one point in your life, if you know that you are going to end up taking long to settle down and get a baby when you are younger, please preserve your eggs, because the number and the quality of eggs goes down very sharply, especially after the age of 35. For men, your lifestyle will directly impact your ability to, 1, become intimate, 2, produce the seed that a man produces, number 3, the ability to deliver it, and number 4, it will also affect the ability of those sperms that you deliver to be able to work towards being able to fertilize.
Now for a final word away from the doctor's desk and also from Susan.
Well, one day I work morning to evening, all right? So I last with my wife and my children. I've participated in their education fully. There was no other better way of relaxing. If we need a holiday, we drive and go, or fly and go. Or read medicine. My memory is the joy of being one of the top students, pupils, and so on. That's why I'm here.
It's only God who is able to give us children. The doctors can try their part, you yourself, you can try your part, but God can choose to bless you differently. It is possible to heal even before you get children. Today here I am, happy and blessing God that I am able to narrate it with no tears and with no, I don't have those painful emotions in me today.
That was a very informative episode, and for me, my take home is time. In as much as society may advocate for women to have children when they feel physically, psychologically, and even economically ready, regardless of their age, the factor of time cannot be ignored. And women do have an age range where their fertility is at its peak. It is very important for every woman to know and understand this so as to make informed choices with regards to their birthing plans. Then again, as we have heard, fertility is not always guaranteed, even in the young and healthy. Ultimately, children come from God, and may He bless you with them if you so desire. So that's it for today, and I look forward to seeing you in our next episode right here on Family Health.